I'm a doctor of physical medicine and rehabilitation with fellowship in sports and spine medicine. I've been a yoga practitioner for 20 years and a yoga instructor for 15. And I've seen a myriad of yoga injuries during my lifetime. Let me tell you, it could be a very, very dangerous activity. Today, we'll be discussing 5 of the most common injuries that I see in my clinic today. So injury number 1 is hamstring injury. Typically, a person comes in complaining of pain in the back of their hamstring that happened either chronically or acute. It's been going on for over 3 months or less than 3 months and happened because of a yoga class. Because they either pushed themselves further than they could, because they pushed through a previous strain that happened in the hamstring, because they didn't warm up, because they overstretched, they were tired, and boom, they develop pain in the back of the hamstring. And typically what the protocol is, the person comes in, I will do an ultrasound in the office. I will find out exactly the degree of the muscle that's affected. And the reason why that's important is it will tell me how severe, and that will in turn tell me how quickly the person will recover from that injury. And if it's a larger type of a tear, it will also tell me that the person might need PRP, which is their own blood injection. I will spin it around and re-inject it back into that area, which is a very, very helpful treatment for this type of an injury. The second type of an injury is labral tears. I find that labral tears are much more common in yogis and yoginis, especially because of all the shoulder handstands, chaturangas, arm balances that we do. It predisposes us for this type of an injury. Typically, the pain complaint is a deep, knowing pain deep inside the shoulder. The physical exam is usually not that helpful. We usually need to get an MRI to determine this. The MRI will tell us this finding. And for this type of a treatment, you either need PRP, which is your own blood injection, or you need prolotherapy, which is the sugar water injection, to make this go away or to diminish the pain significantly. You basically need to restabilize the shoulder all over again, because typically as a result of the yoga, you have destabilized it a little bit. The third most common injury that I see is low back pain, specifically sacroiliac joint instability. I have a separate video on this topic altogether. This is typically a chronic pain, especially among the population, the hypermobility population that I see. So people who are very stretchy, who are very bendy, they're typically come in complaining of pain that's traveling from their back into the buttock, into the thigh, or only in their thigh, or only in their butt, especially when they're sitting on the soft couch or on a cushion for extended period of time. So if they're not able to meditate because of this pain, that sometimes causes the bells to ring in my head. It's pretty difficult to diagnose this condition very often. The MRI is not helpful. You would typically get an MRI and the MRI looks completely normal. The best way to diagnose this condition is actually to do an injection. You inject the SI joint with ultrasound or with fluoroscopy, and the patient all of a sudden gets up. Oh my goodness, the pain is gone. And that clinches the diagnosis. And so very often what you do is you combine that injection with some sugar water, which is a treatment in itself, or you do that first and then you do the PRP, which is your own blood injection, to again stabilize the joint, because what happened is probably over time the joint became a little bit unstable, a little bit loose. And again, success rate is fantastic for this type of an injection. The fourth most common injury that I see is wrist. So in yoga, we put a lot of weight on our wrists before typically properly strengthening them. So your typical downward dog, your planks, your arm balances. And so as a result of that, we put a lot of weight specifically. There's a very, very sensitive structure in here called triangular fibrocartilage complex. And when that structure is at a very significant risk of injury. And when you injure, you develop various types of tears in that structure. And there's only two ways to repair it, either with injection or with physical therapy. You could also do occupational therapy. I typically do start with that as well. It depends on the severity of the tear. If it's a mild tear, occupational therapy works really well. If it's a significant tear, you need to go straight to injections. And again, the type of an injection, it's not cortisone. It's either prolotherapy or PRP. You want to regenerate that area as much as possible. Some people, unfortunately, do need surgery for this type of an injury. And finally, the fifth type of an injury is your knees. Your knees are only supposed to move in one direction. And when you start twisting, turning, trying to squeeze them into a position that they're not supposed to, i.e. lotus position, a lot of people don't understand that when you're in lotus position, most of the twisting happens at the hips, not at your knees. And so when you end up trying to twist your knees, you actually end up hurting your menisci, your ACL, your PCL. And when you do that, you are actually putting yourself at risk for a meniscal tear. Meniscal tear is the most common injury that I see among yogis and yoginis. And most don't require surgery. Most get away with physical therapy, but a large proportion require injections. Again, prolotherapy, PRP, and those that fail, they do go on to needing surgery as well. So that's my overview for regenerative injection. Hope it was helpful. Like and subscribe. Have a great one.